I'm Sylvia Gordon.
And I'm Rebecca Gordon.
This might be our last broadcast. If the Alliance of Community Health Plans has their way, they will get rid of the FMO distribution model as we've known it for 40 years. They will also get rid of the rest of the hierarchy. The MGAs, the SGAs, the GAs, the IMOs, whatever. Anything above street.
Or they won't get rid of them, but they just won't basically.
Well, they won't be able to function under the proposed payment system that the Alliance of Community Health Plans has suggested. Now, we first brought this to you when they sent this letter to CMS in October.
And they were saying that basically we were steering agents to sell big carriers because they were getting exorbitant junk fees up to $1,300.
So who is the ACHP? That is an alliance of 30, I don't know how many, but they're in 37 states, of small non-for-profit
little teeny carriers.
Little regional carriers.
That are really mad that they're not getting
Here's
business.
The names of some of them. Geisner, Community Care, Aspire, Health Alliance, Oxner, Pacific Source, Select Health. So the little tiny guys,
Small
little tiny bit of the market. They're mad that they're not getting more of the market share, and they think that it's our fault that we are steering everybody to sell United Healthcare, Humana, Aetna, Cigna, and WellCare.
And they think that the agents are collecting fees of up to $1,300.
Double fair market value. Now, when this came out in October, I said, where did they get this number?
Prove it.
We went through all the health risk assessments, all the extra administrative fees an agent can get. You can't come up with that. There's no place you could come up with it. And I went and I emailed my other FMOs. I'm like, is that in Texas? And everybody said, no, I don't know what they're talking about.
Right.
But they have doubled down on it. They wrote another letter to Congress in January, and they said that some brokers are collecting up to $1,300, more than double the cap set by CMS. One lawmaker even compared the add-on fees to junk fees. And this is leading brokers to enrolling consumers in plans with higher broker compensation that do not provide the best quality care.
But yet no one can show us these plans that pay an additional $1,300.
People are choosing United Healthcare and Humana and Aetna over these little guys precisely because they have a better plan, a better benefit, better extra benefits.
Better everything.
Better service. Have you ever tried to get service out of these little guys?
Right.
They don't have any staff.
Right.
So they're trying to say, well, we're not getting any market share. And it has to be
our fault.
The FMO's fault.
We are telling our agents to go there.
So they suggested to cut FMO compensation. And by FMO, they mean everything in the marketplace. That FMO, SGA, MGA, GA, everything above street is considered FMO money. Okay. So anybody with an agency, this is not just the FMOs, this is everybody. They say that should be limited to a total. In October, they said $31. Now they came back in January and they said, you know what? You guys do a lot of training.
Might need more.
They read our letters that we sent to Congress and or to CMS, and they said, yeah, you do training, you do support, you provide Sunfire, you do CE, you help with contracting, you help with certification. So maybe we'll give you an extra $19. So
$50.
$50 for the FMO to share with the SGAs, MGAs, and GAs, anybody that's doing anything above street. So clearly, if this passes, it blows up the whole distribution system. And they're basing it on the fact that this $1,300
that nobody can prove.
So luckily, one of the FMOs went to his congressman and said, hey, can you make an inquiry to CMS? Where is this? What is the source of this $1,300? What's your proof? So they had 6 other congressmen sign on to that. So CMS has to answer. So I'm anxiously awaiting what they're going to come up with, because to me, they pulled this out of the air. Unless there's like one county in Vermont, I mean, it's not.
Right.
It's not. It doesn't exist. How if fair market value is basically 6, how they're getting another 7 out of these extra fees, and they're not getting it in any of the plans that I work with. So I want to ask you guys out there: do you feel, just if you work with Gordon Marketing as your FMO, do you feel that we push you to sell United Healthcare and Humana? Do we steer you to the big carriers, to WellCare, to
Aetna?
To we pushing Aetna?
No, because steering is illegal.
Yeah, steering is illegal, but I don't know how they're saying I don't care what you sell. You're independent.
What they're losing sight of is that, the agents run their own business.
Agents
the FMO doesn't.
Right. They're not employees of ours.
They
I can't
assume
tell
that we
you.
give
I can't tell you to
everybody
go sell United Healthcare. I don't tell you that. We say, here's all the products. Here's how to get contracted, how to get certified. Here's the hot points. Here's the stress points.
To look at.
We support you and to try to answer your questions.
Compliance.
We don't care what you sell.
Right.
We don't care what you sell. You are an independent contractor for these insurance companies. You determine what you sell. So are you being steered by somebody else? I say the reason agents sell products is because it's the best product for their client in their market. It has the best price and the best benefit that year. It's an ease of doing business with that company. So why don't agents sell more of these small little regional guys?
Probably for the reasons you just listed.
They're not as
Easy
competitive.
doing business. Not as competitive.
Right? Why are you guys not selling for the little guys? So the question is for you. Let us know in the comments because we're not steering you. Now, the fact that Humana is available in 90% of the U.S. counties and United Healthcare is available in 87% of the counties. I would think that most agents say it's easier to sell with the big because they're everywhere I am. I don't have to get contracted with 15 extra companies.
I already know how they work.
I know how they work. I like their
claims.
service.
They do a great job.
Right?
I don't need
a bunch of these little guys that don't have hardly anybody working there to support me and answer my questions. I work with some of the little companies and they are a little bit more difficult. I'll say that nicely.
You did.
Did I say that nicely?
You said that nicely.
So I'm saying let's switch to let's put this on the screen. This is how many counties, how many plans are available per county. The average person in America in 2024 has over 40, 42, 43 plans available.
This is amazing. So which ones are you going to pick? Are you going to pick, if you look at Summit County,
Ohio,
are you going to do 87?
87 plans. So how many companies is that? At least 20, 30 different companies. How many agents want to take 30 different certifications?
Mm-hmm.
They don't want to do it. That's the barrier to entry. Maybe CMS gets rid of every individual company's certifications and they want us to sell more companies. But it takes too much time to get certified with 20, 30 different companies.
It's unbelievable.
Right? And look, some of these places in Texas, they have 90 plans available. So people are like, I'm going to stick with the big ones. Yeah. They're stable. They're here year in and year out. They're not getting sold. Mm-hmm. They're not going out of business. Right. It's easy. I've been working with them for years.
They do a good job.
They do a good job. You sell what you want to sell. And if anybody from CMS is watching this,
leave us alone.
We don't,
What can we do at this point to help coach agents on what to do with this right now? Anything?
Agents can't do anything. Really, nothing's going to be done. All the responses to CMS are in there. We're going to wait and see what they decide. The question is, who survives this? Does the FMO survive? The MGA, the SGA, the GA? Or is it only going to be the carriers direct to the agent? Because the next step after that is the carriers direct to the client.
Dun, dun, dun,
dun, dun. Stay tuned. More will be developing.